So as we've heard eloquently from my very dear friend, Professor Bashar Effendi, about the new risk calculator. And the question really here is about the aspects of age and duration of diabetes. Both of them are mentioned in the risk calculator. As our chairman mentioned, it's always a dilemma of advising the patient on fasting or not. A dilemma for the healthcare professionals, as well as a dilemma for the patients themselves. And come to the simple two questions of age and duration of diabetes. Do they really matter or not? And do we have any evidence for this or not? As just been presented by Professor Effendi, these two aspects are part of the new risk stratification tool. And the question really is, do we have evidence for this or not? Now, coming to the point of age. Now, with age, you can argue with Ramadan, there is the very young and also the older generation. With regards to the type 1 diabetes and the adolescents, this is only, I will cover it in just a couple of slides, because the data analysis that we've just completed is for type 2 diabetes. But I reflect on our large survey for type 1 diabetes, which we published just over 12 months ago. And if we look into the publication, you will see that we've dissected the data based on age. Young people below the age of 18 versus older people. And there was no difference whatsoever that make us be concerned about people who are in adolescent age. Of course, from an Islamic point of view, there is certain age that people are legally required to fast. And of course, we are talking about people with diabetes, so there is plenty of reasons for these young people not to fast. But from a fitness point of view, we did not see higher rates of problems in those who were below the age of 18. When I reflect on the ISPAD guidelines, this very excellent children and adolescents guidelines, which was published 2 years ago next month, they asked the question, should children and adolescents with type 1 diabetes fast during Ramadan? And they also provided the answer, is they may fast provided certain criteria are fulfilled. And I hope that the risk calculator that eloquently presented by my very good friends, Professor Bashar Effendi, would help us to come to who can fast within the group of type 1 or not, whether they are young or older. Now, let's move to the traditional issue of fasting related to age, which usually talks about the older person. If I were to reflect on the older guidelines, from the first one, which we published in 2005, we simply said high risk for old age with ill health. And we did not mention anything about duration of diabetes. The same was for our document in 2010, which our chairman was a co-author in as well. And my colleagues who published the guidelines in 2015 from another group, and also in 2020, they moved here to specify an age, which is above the age of 75, but no comment on duration of diabetes. And here the advice is, in my opinion, is loose, where it says may choose not to fast. If we go to the South Asian Health Foundation from UK and the publication that was last year, there's no mention of age or duration of diabetes. Perhaps as the culture in UK, that age does not matter, what matters is health, so it was not mentioned. In our pre-last guidelines of the IDF collaboration in 2016, we have mentioned here again, the same point is of no mention of duration, but we said old age with ill health would be classified as very high risk. The Canadian guidelines did not mention anything related to age or duration, no mention in both of them. So I think that the Pakistan issue of the Journal of Pakistan Medical Association, when they had a chapter on elderly, it eloquently as well described the issue of age and elderly. Of course, we know that many people who are older age, they fast. But it is not just about the age, it's about the general health that we need to look into. But still, nevertheless, duration of diabetes is not mentioned. So the question really is, do we have any evidence that age is of concern? Now, I would like to reflect again on the excellent survey that was published last year of type 2 diabetes, nearly, as you can see here, nearly 6,000 persons. And when you dissect the age group of the group, you will find that the vast majority are in the middle age of 41 to 65 years of age. That's nearly 70% of the population. But still, specifically in our region, we have a very sizable population of below 40, 12%. And we have 19% or so above the age of 65. Now, you don't need me to tell you that for every single complication that age matter, hypertension, hyperlipidemia, retinopathy, neuropathy, nephropathy, macrovascular disease, and foot, with all of these complications, with every single complication, the higher group of age would be represented with a higher proportion. But when it comes to fasting, that also reflected on the decision of the person of an older age group. So have a look here at the age of 60, above 65. 70% only decided in type 2 diabetes to fast, while in those who were below the age of 40, it is 91%. When they fast, there is no major difference in the average number of days fasted, but the decision to fast or not is very different between the two. When you look into hypoglycemia, hypoglycemia is certainly higher in the age group of the 17 versus 15%. And also, when you look into the decision of breaking the fast, that was higher, reflecting the higher rates of hypoglycemia in the older group. Now, what about how severe the hypoglycemia is? We here look into two aspects, which is emergency admission or emergency consultation or hospital admission within the three age group. And you can see the linear line going from 1% to 9% for ER consultations, and for admission from 0 to 2.3%, which makes the total difference between the two 1% versus 11.6%. And this was highly statistically significant as well. So clearly, severity of hypoglycemia matters to a great deal between the younger person and the older person. Now, Ramadan is not just about hypos, it's also hyperglycemia. And as you can see here, when we look into a percentage of hyperglycemia, 19% versus 12% between the two age groups. And for hospital or ER admission, 10% versus 8%. I would like to remind you again that this survey was done during the peak of COVID, and access to hospitals was limited. So perhaps if it's a different time era, it would have been different. So I've shown to you the data of age. What about duration of diabetes? And why should duration of diabetes matter specifically in Ramadan? Well, duration of diabetes is something important, and in our latest Emirates Society guidelines published nearly 2 years ago now, we have looked into age as well as duration of diabetes. This is for cardiovascular risk categorization. Clearly here, we differentiate between the younger and the older, and the shorter duration and the longer duration. I'm delighted to see that 2 years after our guidelines, the ADA has moved as well to include duration of diabetes into their risk categories for cardiovascular assessment. But what about Ramadan? Do we have evidence that it matters in Ramadan as well or not? Well, I will share with you the data that we've just analyzed and completed. Here is the 5,665 persons with type 2 diabetes, and the vast majority of them, 60% of them, are less than 10 years or less of duration of diabetes. But that means that 40% have duration of diabetes over 10 years. And here we'll represent the data always as 10 or less, 11 to 20, and more than 20. When it comes to baseline characteristics, there was no difference in gender. Certainly there was difference in mean age. So the shorter duration of diabetes were about 13 years younger than those who had diabetes for 20 years or more. Glycemic control also showed a mirror image where less proportion of people with longer duration of diabetes were well controlled, and of course would be higher rate of them with poor control. And it comes also without saying that those people with 20 years of diabetes duration, much more of them would be of the older age group compared to those who have shorter duration of diabetes. So when it comes to comorbidities, again, it's the same pattern that we saw with age. Every single comorbidity or complications is higher as we get longer duration of diabetes. Every single one of them is higher with longer duration of diabetes. And this is also highly statistically significant. So how did this reflect on the intention of Ramadan fasting? Whether just the intention or the number of days fasting or the breaking of the fast. You see here, those who have the shorter duration of diabetes have the highest rate of fasting, while those with the longest duration of diabetes have the shortest or the less percentage of fasting, which equally represent very much the figure of those who are above the age of 65. But once they fast, the difference in number of days is only about less than 1 day, and indeed breaking the fast is slightly higher among this longer duration age group. Hypoglycemia also was directly proportionate to the duration of diabetes. This is here, 24% developed hypoglycemia if they had duration of diabetes of 20 years versus 14% for those who have diabetes for between 0 to 10 years. Severity of hypoglycemia also was directly proportionate. As you can see, the difference between 4 and 13.6%. Admission also was 3 times higher because in the younger age duration of diabetes age group, they did not have any hospital admission. So when you put the two together, you end up with 4-fold difference, the difference between 4.3% and 17%. And it looks like the cutoff figure where it breaks up is the mean age of the 11 to 20 years. So hyperglycemia equally is the same issue, higher with those who are with longer duration of diabetes, and for them, 46% of them had a frequency of hyperglycemia more than 7 days per the month of Ramadan. So again, the severity of hyperglycemia with going to ER or hospital admission very much linked to duration of diabetes and giving us over double that rate as well. So, Mr. Chairman, ladies and gentlemen, my conclusion is that the percentage of people who decide to fast, the rates of hypoglycemia during Ramadan, the severity of hypoglycemia, the rates of hyperglycemia, as well as the severity of hyperglycemia, are all related to age as well as duration of diabetes. And these two factors are important in the assessment of a person who wishes to fast the month of Ramadan. This is the score again that we have. Perhaps we need to think of the weight or some of the wording, but certainly age consideration and duration of diabetes consideration are really important. Thank you all, and I look forward to the questions and answers at the end of the presentation.